Okay, so okay, yeah, I will focus on the 2023 attempt also. Don't worry about it. Sure. Okay, so good afternoon, everyone. Hope you're all doing great. So, am I audible and clear, right? Loud and clear? Yes. Okay, so let's start. So, first of all, let me introduce myself, so that it's been what to say. My journey into the civil services has been really a long one. So only thing is that yeah, it was a pretty long one, but at least on the hindsight, if I look back, I'll be at at least at a little bit better position to at least tell from my. So am I not audible to you guys? Am I audible or not? Can anyone reply?
Yeah, you are audible, sir. To me, you are audible.
Okay, so I think there is some problem with your connection only. Can you just check it out? Like because for others it is audible. The channel. Audible. Okay, fine. So let me start. Okay, others check your connection. I think I'm audible for most of you guys. Okay, so let me start about my journey with civil services for a brief 1 or 2 minutes. Basically, I did. So all of you are MBBS students, right? All are doctors only, right? In the session. So no one else is a non-medico here, right? In this group. Okay, hope that everyone is a medico only. So yeah, I did my MBBS. I belong to the batch of 2010, and I completed my MBBS from JIPMER, Pondicherry. So the very reason I wanted to come into the civil services was that I was slightly interested into social work and especially politics, all these things were in my hindsight during my preparation times. So during my MBBS time itself, I had, and I was also the JIPMER Students Association president in the year 2013-14. So all these things motivated me to enter into civil services because there is a lot of avenue towards that. So that is why I started preparing, and I started immediately after my internship. The first big thing which I made was nowadays people start preparing even during internship or just before that also. But the only problem those times was I didn't do that. But the first mistake I did. So I'll talk about the mistakes which I've done during my preparation. But anyway, so I started immediately after my internship, which completed in January. So my first attempt I gave in the month of August. So I hardly had 6 months of preparation time. But I thought, okay, 6 months is more than enough for this exam. And I gave my first attempt directly in that year, within 6 months time. So I didn't prepare anything about mains. Directly, I went ahead and I gave my prelims. I thought I was very lucky because I cleared prelims that year. But I thought I was right. But the biggest unlucky thing which has happened in my preparation is that I cleared that first prelims. Without much preparation, I went into mains. And without much preparation, I cleared that mains also. And I went into interview stage. And ultimately, when the results came only, I realized that I have not scored much in my mains. So I missed the cutoff by almost 16 marks that year. It's a big gap was there. The worst thing was the second attempt. Again, there was only 14 days for my prelims. Again, the same cycle continued. So what happened was immediately in 14 days, I again prepared only prelims, and immediately again the same cycle of mains continued. But second year, I got a rank of 508. It was not enough. So I got into postal and telecom account services, financial services, but I felt being a doctor, there is no point in joining some accounting services, revenue services, etc. So that is why I didn't join the service. I didn't take up the service. Even in the second time, when I got a rank, I had an opportunity to opt for IRS, IT. I would have got probably, but the thing was again, I was not interested in joining any other service apart from IAS, IPS because I always filled my option also IAS, IPS only. Because I personally feel, this is my personal opinion. I'm not telling that other services are low or lesser or much better or not, but I personally feel doctor is something which we're already doing a great job and we have a very good career ahead of us. So we should be extremely careful while choosing the service also, because IAS, IPS, yes, it definitely makes sense, I feel, choosing over medicine. And sometimes even medicine can do better. I'm not saying that. Yes. But only thing is that when you go beyond an IAS and IPS, I personally feel it is not that great to take being a doctor, leaving it and coming back. This is my personal opinion. So that is why all the more where it is very important for all doctors to score extremely well in your mains marks, because 2-3 marks can change your services. Because for other people, just entering into the list will suffice. Okay, I entered into the list, my name came into the list. Yeah, they'll be very extremely happy. The same will not apply for doctors. You have to get a very good score also as much as possible. So that is where we need to be extremely careful. And that is why once I got IPS only, I joined the service. Okay. So this is the brief journey about me. And I have given 5 interviews and I have got 3 services till now. So this is a brief background. And I also worked in combined medical services also for a brief stint of 4 years, like 4 months, sorry. I got a rank of 141 in combined medical services. So that I thought, let me like do something, because immediately after my second mains, I thought no point in sitting and studying. I'll work as well as prepare. So I went into combined medical services. But once I went there, I didn't really like the way in which things were working, because again, it is more like cold coffee we're treating daily. So I thought I'll focus better on my preparation, and I came back for preparation again. But only good thing I did was immediately I started working with Shankar IAS Academy. I had an working experience of Shankar IAS Academy for 2 years. Okay, mainly, especially I was dealing with current affairs, economy, and medical science. And I was also working with one other academy in Chennai, which you will not know, Vetri IAS Academy. There also I was dealing with current affairs. Then after that, I shifted to Forum IAS. I worked in Forum IAS as the director for MGP program. So I was dealing with the entire mains guidance program, all the test series, answer evaluation, all the basically I don't evaluate papers. I finalize the question papers and the solutions for the MGP program. So that was my role. So based on this experience only, I'm going to talk whatever I have done throughout my stint of 5.5 years into this preparation. And what I would like you all to hear is that 2 things. First, based on my experience, few conclusions I can tell you based on my experience and my personal experience only. You can take whatever you feel like taking it from it. Second thing, most important thing I would all like you to have is that based on experience, whatever mistakes I did, please don't try to repeat it, so that you can save so many years of yours. So these are the 2 agendas I'm going to focus on this entire session. Okay, fine. Before I go into the session per se, this is a brief introduction. And how many of you are going to write mains this year? First, let me see if a lot of people are there, or anyone is there who's ready going to write mains this year. Okay, 1. Ankur is there. Anyone else? Okay, 2. Ravi. Okay, then few people are there. Okay, who are going to write mains. So for the sake of their time, first 15 minutes, I'm going to focus on the core part of medical science, so that they all get benefited initially. And after that, if they want, they can leave also. Anyway, it's going to be useful because I'm going to talk about medical science paper only. After that, I'll go to 2023 and other things also. Okay. Is that okay with everyone? Okay. So I would like to hear some yes or no, so that it becomes more interactive. This is not a classroom, right? If it is, it's like a dialogue. It's much better for me also. Okay.
Yes, sir.
Okay. Thank you so much. Okay. Done. So coming to the mains 2022 per se right now. Ajay Raj Singh, can you just, I think there's a background noise.
Yes, here, sir.
Okay, I'll just mute you. Okay, done. So the first thing is that, first of all, for any exam per se, there's a difference between becoming expert in that subject, and there is a difference between clearing the exam. So first thing to note is that all of you are here to clear the exam and not to become an expert in the subject. Always remember that, because I have seen so many people who make detailed notes, who bring like huge notes they have of medical science. They do a lot of things, but ultimately that does not translate into scores in the mains exam, because they're more interested in mastering the subject rather than implementing it in the mains. That is the biggest mistake everyone makes in medical science, because this is a huge syllabus, extremely huge syllabus, very difficult to complete. And leave about the revision, that is a secondary aspect, but to just complete the syllabus, it's huge. So first thing first is that, first all of you, I would say is that, first of all, go through last 10 years question paper. That's the first thing everyone has to do. And if you could see, especially in subjects like pharmacology, surgery, medicine, pediatrics, these 4 subjects per se, I have never seen any question which is not repeated at all. Never seen. Even if it's repeated, probably 10 marks gets like a new question comes. Otherwise, all the questions which are asked from the subjects are only repeated every year. So these are the first thing you should do. So the thing is that whenever you are preparing, say for example, let me take one example. So cyanotic heart diseases is there in the syllabus of pediatrics. But till now, till date, what they've always asked is that they've asked only about TOF only, tetralogy of Fallot only, they've asked every time. They have not asked anything else. So when I am preparing for medical science, if I start reading all the cyanotic heart diseases, there are 5 or 6 cyanotic heart diseases, you all know. And if I read everything in detail and practice everything in detail, that is one aspect of preparing. But the second aspect of preparing for the exam is that I will read only TOF in detail. I'll practice the TOF diagrams also as much as possible, because I need to complete within the 7 minutes time. And what more is asked is that only DDs. So other topics names only I will just go through it. Okay. So whatever names are there only, I'll know, okay, if TOF is asked, what are the DDs to be given? How to differentiate TOF from other diseases? That much only I'll read if I'm preparing for this medical science exam. On the other hand, most of us, how do we prepare is that we start reading each and every cyanotic heart disease in detail. And when you're giving importance, what happens is TOF is also given equal weightage. Like even Epstein's anomaly is also given the same weightage when you're preparing. What happens is that your answer becomes in TOF very mediocre in nature. But the person who has smartly prepared for this exam will prepare only TOF in detail and he'll write a better TOF answer than you. And obviously he'll score more marks than you. So that is the first thing I would say is that see the 10 years question paper, whatever is asked in this question paper, first prepare that in like extreme details with diagrams, whatever value addition possible. Say for example, any recent advances are there. We always Google for recent advances. And especially in case you have any of your friends who are preparing for NEET PG or some other PG exam, they will have their notes, standard notes, which are provided by DAMS or Marrow or whatever it is. Just call them once and discuss the topic with them. Okay, what are treatments for TOF? Because the treatment which we read from OP guy is sometimes outdated. Lot of outdatation has happened. But if you just add one word of extra treatment, a new surgery, a named surgery for that, that gives you the added advantage. See, I'm telling you, this is ultimately a race, and each and every value addition you give, it is going to be scoring for you, because the person who is going to evaluate your paper is definitely pediatrics paper means it's evaluated only by a pediatrician. Okay, if it's a surgery paper, it's only by a surgery professor will be evaluating your paper. That means it's no layman is going to go and evaluate your paper. Please understand that. So the more value addition you give, the more they will get appreciated in the paper. This is the first thing. So second important thing is that in view of 2022 means, okay, extremely vast syllabus. First thing, you're going to complete all the 10 years question paper, whatever is there, so that any repeat question, you never miss it. So if you ask me on the scale of percentage, how much percentage of marks gets repeated in every year? If you can read the last 10 years question paper, I think 70 to 75% of the questions are repeated. That is the reality. So people say that I'm not able to score more than 250. Medical science is a very difficult subject. Yes, I understand it's a difficult subject. But the problem where it goes wrong is in the strategy and planning itself. If you can plan a strategy properly, I think 250, 260 is extremely easy to score. Because all the times I have written, my least score has been 267 only. Never less than that. Okay. And I can tell you, even in the last attempt, which I was totally unprepared, I just gave for the sake of giving the exam. Even then I got 267. That was the least marks without preparation I went. Why I'm telling you is that people focus on completing the syllabus, start taking so much notes that it becomes very difficult to revise also, and they just get scrambled in the exam. That is the biggest mistake everyone does. So first thing is that you're going to do the 10 years question paper. Second thing is that then go by the syllabus. Okay, so what are the points which are not covered? Because sometimes the compulsory 10 markers come beyond the 10 years last repeat also. So those areas, then you go by the syllabus, how much ever possible, try to complete. Okay, what are the important topics? Say for example, there are some topics in biochemistry, physiology, which are extremely difficult. You know that. There are few topics which you can skip also. How I'm telling you is that, see, always in a paper, there are section A and section B. In paper 1 also and paper 2 also. So I always had a strategy that I'm going to write 2 questions because you need to write only, say, first question and the 5th question are compulsory. And from the other 2 sections, in one section, you have to select 2 questions, and another section, you have to select 1 question only. So that is a paper pattern which we have. So I always had a strategy already made in mind that I will read anatomy, physiology, and biochemistry very thoroughly, because section A itself, I'll choose 2 questions. And similarly, in paper 2, I was not very confident with PSM. So I always do the part 1, that is medicine, dermatology, and the psychiatry part. So that again, from that section itself, 2 questions I lift it out. So that from the second section, I'll take only 1 question. Even if I'm not extremely thorough, okay, it's fine. 4-5 marks, if I leave also, it doesn't matter. Because ultimately what happens is that when people prepare, they think that you need to write all the 500 marks which is given in the paper, and ultimately they end up getting only 200 marks. What I'm trying to tell is that it's an extremely difficult paper. Do not aim for the 500 marks. 250 means all the answers has to be repeated, like written all extremely, like whatever is there in the book has to be reproduced. Do not try to plan so much, because if you're targeting so much, you have to read so much also, which is literally impossible, because you have ethics, essay, so many things to do during your preparation, right? So you should be little smart enough so that even if you attempt for 480, 470 marks, but in a very good manner, I'm telling you will cross 300 marks. But that very good aspect is the most important thing. Okay. And second important thing is that because this is medical science, even if 1 or 2 questions, say for example, you are selecting 1 subsection in section B, Out of that 5 questions, you know only 2 or 3 questions. Rest 2 you do not know. But because we have been into the field of medicine, at least something about that you can definitely write. It's not that you will not have any zero idea. You do not know anything. Like that questions, it's rarely possible to be asked because we have some idea about everything here. So even if you write that some idea, you still end up scoring good marks. In the like 1 or 2 questions I'm saying. So even if you don't attempt for 500 marks, try to attempt for 480 in a very strong way. Remaining 20 marks, at least try to just decipher the meaning and write whatever you know. It's more than enough. So why I am telling you this important point is that instead of focusing too much on like random subjects, focus on section-wise subjects. Say for example, if you are reading anatomy thoroughly, you should read biochemistry and physiology also thoroughly. There is no point in reading anatomy thoroughly and pharmacology thoroughly because both are in different sections. So you need to section-wise concentrate, and section-wise you should be extremely strong so that you choose 2 questions from the same section. That should be the second strategy, I would say. And third important thing, extremely important, is that a lot of people miss out on the practice part. Medical science paper, to complete the paper itself is a huge challenge. What a lot of people I have seen is that they think that, okay, medical science, even if I don't write test series, it's fine. I'll go there and tackle the paper. It never happens like that. At least you should at least take 4 mock tests. Like paper 1 ka 2 mock tests, paper 2 ka 2 mock tests are definitely required from my experience, I'm telling you. Because what happens and what I have seen from my own students, because I have been correcting papers of medical science for the past 3 years now. I have seen a lot of students, what they do that first question, they write like, say for example, the first question is knee joint answer is asked. Obviously knee joint, you can draw so many diagrams, you can write so many things about knee joint because you will be extremely thorough because only 3 joints are there for a syllabus. Everyone is very thorough with the joint answer. What they will end up doing is that one knee joint answer they will write for 20-25 minutes. But ultimately you're going to get 15 marks only for that. What happens at the end? You will start rushing and your score goes down. So whatever is that, if it is a 10 marker, maximum time you are allowed is 7.2 minutes. If it is a 15 marker, 10.5 minutes. But if you overshoot it, you're going to miss out on the last answers. That is for sure. Because in medical science, every answer you will have some knowledge. It's not like GS. You don't have zero knowledge about any question so that you will miss 1 question and 2 questions and come out. Medical science, you will have some idea about everything. Even some random ganglion is asked. From your UG knowledge, at least where is that ganglion? What are the nerves attached? What are the things which can be associated with this ganglion? You will have some idea. So any answer, you need at least 7 minutes time to write. So make sure that no answer you overshoot it. And this practice of writing an answer along with diagrams within the particular time will come only with practice. Only with practice. Nothing else can take it. Okay. So this is the third point. Before I go into the fourth point, I'll just take the question. Rahul, you have any doubt?
Yes, sir. So my question is regarding to the compulsory questions. There is a section in section A and B. There is a question number 1 is compulsory. Also 5th is compulsory. In that question, there are definitely odd questions are they are putting. So if is it good to attempt them if even you don't know, or better way to leave that?
Very good question. So exactly, when I told that, so the thing is, there are basically question number 1 and question number 5 are compulsory questions. So that means it has 5-10 marks each actually. So basically 100 marks are compulsory. So again, only when you complete the entire syllabus in thorough, you can actually answer this 10 questions. That is why I told you to aim for 480 only. Because when you are focusing on the past question papers more, it is highly probable that you will not complete the entire syllabus as much as possible. So in that compulsory questions, at least 1 or 2 questions you will not know at all. Because you're not like, because if you have to complete all the 10 questions properly, you should read so much and come as if you are preparing for NEET. That much of preparation is needed if you have to attempt all the 10 questions. So for a normal person who is going for this exam, at least 2 questions you will not know. Say for example, last year, I'll tell you one example. Otic ganglion was asked. I literally have no idea about otic ganglion because I read in the first year anatomy. But it does not mean that I cannot attempt that answer. At least I know where the otic ganglion is present. Okay. So it has both parasympathetic and sympathetic connections. Okay. What are the secretomotor fibers? Which salivary gland it is going to supply? At least this much small knowledge I had. Okay. Just 2-3 points I wrote about the otic ganglion. Okay. And I tried to make a what to say lateral section of the cheek. Approximately I put a otic ganglion there and just came out. I literally do not know anything about it. I totally forgot. Okay, but still I attempted that question and came out. So what I'm trying to say is that never leave out any question. Because you will have some idea about everything there. Whatever idea you have, just put it in the paper and come. So these are the questions which you do not have much idea. You keep it to the last. So the last 4-5 minutes, tuck, you can write whatever possible and come. So, but it is like strictly prohibited that you just leave some question and come. You cannot do that. You have to write something at least. Okay. Okay. So this is about. I'll come to the notes part, Vivek. Just 1 second. I have 2 more points to cover. Then after that, I'll take questions. Okay. So I've told 3 points. The fourth point, which so I've told about the practice in the third point. The fourth point, which I have to cover about medical science is that, like, it's related to note making also. Always have a set of diagrams with you always. Say for example, if it is, say for example, shoulder joint. In every year, one joint is asked for sure. So at least 2-3 diagrams in each joint you have to practice multiple times so that you can put the diagram in 30 seconds, 40 seconds. That should be the target. You're getting it. And second thing is that whatever is possible to be depicted in a diagram, just depict in diagram. Do not read it as an answer also again. Say for example, let's ask about ulnar nerve force is asked. It's better to draw the skeleton diagram of ulnar nerve. Like say for example C4, like ulnar nerve starts from C7 C8, right? So C7 C8 is the nerve root. From there you just put the arm 2 branches, 2 lines. Okay, in the forearm 4 branches. Okay, in the hand 5 branches, like that. Just put the skeleton diagram and come out. More than enough. So instead, some people what they do is that they start writing. Okay, the ulnar nerve rises from the this brachial plexus and it goes to the this Diane's canal, etc., etc., etc. If you start writing it, definitely you will not finish that answer in 7 minutes. Not possible at all. So what you do is that make a skeletal diagram, and when you're making near the wrist, put a Diane's canal. Okay, passes through Diane's canal here. Okay, in the cubital fossa, it passes behind the this thing, medial condyle. Just make a note there itself in the diagram. Short. Whatever possible in medical science paper, simplify with the diagrams. Only then you will save a lot of time. But this diagram will not come automatically when you go to the exam. You have to practice in the home itself, so that to win the battle, you need to practice here itself. That is the ultimate thing. It does not go just with only medical, say for example anatomy. Even for pathology, if some histology question is asked, say for example rheumatoid heart disease (RHD) is asked, you make a small diagram of the heart, gross anatomy. When you're describing gross, make a small diagram of heart. Okay, this is McCallum plaque. Okay, this is the fibrous septa. Okay. So these are the plaques which are formed. Okay. So in the heart walls, what is the fish mouth appearance? All these things you write now. In that itself, you just mark there and finish it off. Do not start writing theory there. You're getting it? It's better to write. Second, microscopy you go. In the microscope diagram, it will start making theory also there itself by the side. Put a diagram, put some arrow marks on the side, and start writing a theory also on the side itself, then and there itself. So that why I'm telling you is that this is a technical subject ultimately. So the professor is going to test whether you know or not, that much only. He's not bothered about so much about presentation actually. And ultimately, when you put a diagram, it means that your knowledge is much higher than a person who's writing. That is why you are confident in putting a diagram. So that definitely will be appreciated. So any 1 or 2 examples of my paper copies will be given to you. Don't worry how to write this ulnar nerve or a pathology question in a much simpler way with a diagram. I think I already given the notes. It will be shared from the institute side to you. Don't worry about it. Okay, you can have a look at it. This is the 4th point I wanted to talk about. The last point about scoring extremely high in this exam is that choosing the right question. Okay, that is an extremely important but a highly neglected area, because you have choice now. 1 and 5 are compulsory, TK. But apart from that, you have 3 questions in section A, 3 questions in section B. Out of that, you have to choose here 2 and there 1 only. So that means you can afford to miss 3 questions now because you have a choice here now. So how do we select the questions? A lot of people think that, okay, in case they know one answer, say for example, in one of the questions, there are 3 questions, subparts are there. The first subpart you know very well, and the third subpart you do not know anything about it. Okay. What people end up doing is that they try to take that option only, because first question I know very well, I will present it and come so beautifully, so that they'll get impressed by my answer and they'll start selecting that question and they'll write and come. But the third question, the third subpart, they do not have any idea about it, but still they select because they know the first and second question properly. But please do understand that this paper is evaluated by separate faculties. Anatomy part is evaluated by anatomy professor. Okay, biochemistry part is analyzed by biochemistry professor. So in each and every question which you are going to select, there are 3 subparts. So one question will be from anatomy, one from biochemistry, one from physiology. So the physiology professor will not know how did you write your anatomy questions. He will not know. Why will he know? So it does not mean that you make an impression in this one question, your entire answers for the other things also increases in marks. Nothing happens like that. So what I'm trying to say is that instead of selecting a section like a question in which you know only 2 answers properly and third answer is 0, you select some other question in which 3 even mediocre answers will go, because at least you get 60-70% in every question, every part of it. So how do you select a question then? You will have a lot of question. So what you do is that you start making marks also by the side. Say for example, in there is a confusion between second question and the fourth question, which you have to choose. Okay, just 1 minute. If you want, I'll share my screen. Just a second. Okay. Some issue. Sorry. Just 1 second. Okay, is my whiteboard visible?
Yes, sir.
Say for example, let's take that.
Sorry to interrupt you, sir, but your voice is not clear.
Is it clear now? Audible? Better, no?
Yes, sir.
Okay. Better, right? Okay.
Okay, sir.
Yeah. So let's say, for example, the mark division is 15, and 20. So each question has 50 marks, right? 30 and 50. Okay. The same division is here also, 15, 15, and 20. So this is how the marks distribution is also given for each answer. Let's say the second question, A and B questions, I know extremely thorough. So you think that I can get like almost 90% of the marks which is awarded. I can write that much beautiful answers. So 90% approximately translates to around 13 marks. So I'll score 13 and 13 marks in A and B section if I wrote the proper answer. And C, I really do not have any idea. So even if I attempt, I'll get probably 5 marks or 6 marks. That much only I'll get. You make a marking like this. Similarly, here though, I know all the 3 answers, but I'm not thorough with all the 3 answers. But I know something about everything. So you think that, okay, out of 15, I'll get 8 here. Out of 15, I'll get 8 here. And here, out of 20, I'll get some 12 marks here. I plan like this. So how much I get? Here total is 28 marks I get here. But here how much? 26 plus 31 marks I get. So then you should select this part only. But in case the third answer, you do not have any idea in this A part. So you will get 0 only probably. So then you should not select this option. You should go by this option. Even though you know beautiful answers here, you know average answers here, you have to go to this part only. So how do I select is that always try to mark there itself. So based on the percentage, like say for example, if I take this answer and write how much marks I'll get, you should have an idea. But how do you get this idea is based on writing mock tests right now. Okay. When you write mock tests, you will understand how much confident you are and how much of translation it happens there. So based on that, you will understand. And based on this, definitely you can plan your answers also. So I hope I made sense here. Is it clear? Just 1 second.
Yes, sir.
Yeah. So every answer before selecting, make sure you try to understand the marks of it so that it's not just between 2 questions. Even if you have to select among the 6 questions, you need to select 3. So out of the 3 also, you try to mark some questions you will not have any idea. So strike it off immediately. But remaining questions, try to mark it. Okay, based on the rational decision, try to select the answer and write. Because some people will like get guided by emotions. When they see the first question, okay, in one of the part, shoulder joint is there. Yeah, I've read so shoulder joint, so many things, but they don't consider the next 2 questions and start selecting the question and writing it. But your marks get like you lose a lot of marks in that. Actually, people do not like what to say, place attention for selection of the questions here. So how do you select questions is that in a mains paper, you usually get the paper 5 minutes earlier. So actually speaking, these 5 minutes are not enough to select the questions. So usually what I do is that I take extra 5 minutes of my writing time also. Say for example, the paper is given at 1:55 p.m. I take till 2:05 p.m. to select the question only. 10 minutes I take literally to rationalize what question I'm going to select based on the markings, whatever I'm expecting, and then only I start writing. I take extra 5 minutes of my writing time also to select the question. A lot of people in the hurry, what they do in 5 minutes, they just see the paper. Okay, they will not even read most of the questions and immediately start saying, okay, this is what I'm going to write. And they enter into the battle immediately. And this, you might lose out a lot of marks than you expect. Because I've seen so many of the bright minds who are scoring extremely less in medical science because of the wrong selection of questions. Okay. So this is the most important point I want to say. And I think I have done justice based on my experience, like what is required for this 2022 exam. Okay. So these are the 5 important takeaways from my 5 attempts of medical science, I would tell you. Okay. So if you can do all these things properly, no one can stop you less than 270 marks. I'm pretty sure about it. 100% sure about it. Okay. So now let me take questions from those people or anyone else regarding these 5 points only. But whether to select medical science, all these basic questions, I'll just deal after 5 minutes. Okay. Because people who are supposed to prepare, let them, they can leave also. Okay. Any questions regarding this part?
Hello, sir.
Yeah.
Sir, my question is regarding to that 4 question, which most of the new for each year papers. Means if I'm unable to write that 4 question, what will impact on my ultimate score, sir?
That is what now, even if you can attempt for 460 marks, but 460 marks, if you had written so well, I personally feel 275 is guaranteed for you. You're getting it. So if you can write that compulsory questions also properly, 300 plus is possible. So people who have crossed 300, what I have my maximum mark was 301 in 2018 attempt. Okay. That was the maximum 301 I have. So in that attempt, actually speaking, even the compulsory questions, except one question, I knew everything actually. So that is when I crossed 300. So if, that one question I really did not, I think question was regarding the lung segments. I think I literally did not attempt also. I just wrote there are 10 segments in the lung. Some random diagram I put and came. I think I would have probably got half mark or 1 mark only in that. Even then I got 301. So it doesn't matter. Okay, one question, even if you completely leave it also, it doesn't matter. I'm telling you, that is the reality. People in the term of attempt all the questions, even the best questions they write mediocre answers. That is very bad. The questions which you know, you should write excellent answers. That is a priority in medical science. Okay.
Sir,
one more question. Just 1 minute. One question from the chat. Yeah, I'll just take this and I'll take your next question. Okay, which subject selection please attempt? Which should we attempt? Okay, pharma, PSM. Okay, so basically, see, I think it is all dependent on personal experience. But what I feel is which section to select, which question to select. Very nice question actually. So what I would do is that I prefer to select the section which has more diagrams. Say for example, I always prefer to write anatomy section because anatomy has diagrams. So the more you put diagrams, the better scores you're going to get. Right. So or else even in the compulsory questions, pharma, like pathology and all there, right? So those are the questions which will save you a lot of marks and time because you just put one diagram, it will be easier. And second thing, what I feel now, PSM is one subject where random questions are asked every year. Very difficult to do PSM. I personally feel because suddenly they are asking one scheme, suddenly they're asking some other scheme, and it's very difficult to read all the schemes. So a lot of people from PSM will be already here. In case you're very comfortable with PSM, yes, you can take PSM part. But usually I try to skip the PSM part because I find it difficult because to read the every time new program, so many schemes are coming. It's very difficult for me to take. So that is why I always try to choose a section A from the paper 2. So it all depends. Section A of paper 1, why I choose because anatomy is there, more diagrams, more marks. In paper 2, why I choose section A because I am weak in PSM. So like that, you can make a strategy for yourself and you can plan your paper. Okay. So the question someone was asking, what are the questions?
Sir, regarding the question, you have said there are 2 sections, sir.
Yeah.
Means we have a question in section A, number 2 and number 4 question.
Yeah.
You said we have A, B, C parts. You said in that we know A and B very well. We can make it sure. But C, we are not very sure. But compared to the second question, in the other 4th one, the 3 questions you know average basis.
Yeah.
You said to attempt the second one, means 4th question or second.
That is what percentage wise. You imagine how much it's not just average means it can be 30% average, 50% average, 60% average.
Okay.
So that is why I told you to mark and do because what happens is that we make a very big blunder that okay, this side knows slightly, this side knows slightly, this side knows slightly. What does that slightly mean? You're getting it. Say for example, I gave the example of otic ganglion and lung segments also. Both I do not know, but still my otic ganglion answer was better because I could make a picture out of it. You're getting it. Both I do not know only. So
okay,
that is why I'm trying to put marks to that and select the question. Okay. Try to put marks and select.
Okay, sir. So the rationale is the where you can score well, choose that area. Over that area, what you know. Okay.
Exactly. And
thank you.
Second rationale is because you write one answer better, it does not mean that other answers you will score better because the faculty will be different for correcting. same faculty will not correct the entire paper. You're getting it? In GS papers, what happens is that if you have written 4 questions very beautifully, first 4 questions, there will be some amount of carryover in the 5th question also, like half mark extra, because they think that you are a good student. But the same thing does not happen in medical science. Say, for example, an anatomy professor will correct only 3 or 4 questions because that much only is there in your entire paper, anatomy. 4 physiology papers, that's all. So the carryover will not have so much benefits here in medical science paper. That is what I wanted to tell. Okay. Fine. So next question, anything else?
So how much should be the word limit, rather page limit for writing an answer? Like 5 marks, 10 marks, 15 marks. For example, in UG, I used to write, for 5 marks, I used to write minimum 2 pages. So in UPSC, is it like that for 5 mark a question, you'll have to write 2 pages? Kindly please explain that thing.
So what happens in UPSC is that for a 5 marker, there is only half side given to you. Even they give only half, only one sheet of paper is given to you. For a 10 marker, 2 sheets of A, like that is front and back, 2 pages, but that's all given. If it is a 15 marker, sometimes you get 3 sides of A4 sheet and sometimes you may get 4 sides of A4 sheet. This is the maximum space which is possible. That means 5 marker, you cannot write more than 100 words. You can never write, or 75 words is the maximum limit. And if it is a 10 marker, the maximum limit which you can write is 150 words. But what I would suggest is that do not try to write more because you have so many questions to attempt. See, in our UG exams, imagine 250 marks. We had, like, I think for UG exam, we usually have 150 marks, right? 150 marks, we have 3 hours. But here you have to attempt 250 marks in 3 hours. So it's extremely important to save time. So do not try to always write, fill the pages here. If you have conveyed whatever you wanted to convey, all your points are done, just go to the next. And what I again try to say is that even if you have 2 sides, I always write only 1.5 sides for 10 markers because I try to incorporate as diagrams. So all my answers are very short only. So even if it's 15 marker, they have given 4 sides of paper. I have never gone to the 4th side. I always finish it in 3 sides only. If you use diagrams, it will be always short. But only the point is that I feel all the points has to be covered. If like there are some terms, say for example, if it is rheumatic heart disease, which is asked in your pathology, always you need to write gross and micro. And gross may what are the characteristic appearances you need to write. Micro may what are the characteristic appearances you need to write. These are the things which you cannot escape. Say for example, a TB being asked in pathology, definitely you need to write about caseous necrosis, giant cells, what are the different types of giant cells. These are the minimum expectations they will have. So try to write only those important points, whichever is possible. Okay, and do not try to shoot beyond the 7-minute mark in a 10 marker or a 10-minute mark in a 15 marker. If you try to shoot your time limit, what happens at the end, you will face a lot of problems. I think when you write one model test, you will understand what I'm talking about, the time constraint. Because it's extremely difficult to complete medical science paper on time. Paper 2 can be completed, but paper 1 is extremely difficult to complete on time. So try to always save your time as much as possible. Do not focus on the word limits. Okay, as short as possible. That would be my advice. Okay.
Thank you, sir.
Okay. Next question. Anything?
Sir, regarding means we have that time lapse, no, sir, regarding questions.
Yeah.
To avoid that time lapse, sir, means in writing the answers in the UG life, they asked about a particular disease, sir. You said rheumatic heart disease like that. He didn't specific anything. Means we used to write etiology, pathogenesis, whatever and whatever we used to write. But in UPSC, they are very specific in asking, sir. Means if we ask only clinical features, if we write only clinical features and leave it, is that fine, sir? Or should we elaborate our view, sir, like in UG days? I has the doubt, sir.
Yeah, beautiful, beautiful. Extremely important. Whatever is asked, only you write here. This is the difference between our university exam and CSE exam. Say, for example, let's take whatever he asked, rheumatic heart disease. They've asked describe the microscopy and macroscopic features of rheumatic heart disease. Do not go beyond the etiology. Rheumatic heart disease is caused by the M variant of streptococcus. No, not required at all. Okay, you have Jones criteria, that criteria, not required at all again. What is asked? Microscopy, macroscopy. Just stick to that and try to improvise on that macroscopy, putting diagram. If you have extra time, you put diagrams and improvise on it, rather than writing the etiology or the treatment for it or the management for it. If it is not asked, never ever try to attempt. Always stick to what is asked only. The second important extra point I would like to add is that what happens even in a simple question, like what to say, like joints. Everyone reads so much about joints, but every time you see even shoulder joint, what is asked? Nerve supply and blood supply is also asked. Okay, in one of the subdivisions. But what happens is that when people prepare, what they do is that They just read the joint movements, muscles. Okay, what are the bones involved? What are the type of joint? Everything. But ultimately, what they will do is that they will not give importance to nerves and nerve supply and the blood supply of the joint, because we are not used to reading the nerve supply and blood supply in detail actually in our UG days also. So here, what happens, because they cannot address that subdivision, 2.5 marks will be cut off directly from there. So what I'm trying to say is that whatever is asked only you write and prepare in the subdivision wise also. Okay. Second important question, coming to the paper 2 of the same question, whatever he asked. They'll ask about management. Say for example, management of psoriasis. Management includes both investigation as well as treatment. Whenever management is asked, it also means that it is investigation. That not just investigation. How do you make the diagnosis? That is more important. Okay. Say for example, when they ask management of DKA, elaborate on the management of DKA. It does not mean that you write, okay, investigations, blood test is done, this thing's done, okay, urine ketone. Don't like that. So sometimes it's very difficult to write all the investigations, like in microbiology we write investigation separately, lab investigation separately, imaging separately, and then write for the treatment. But in a clinical paper, it is difficult to write like that. So what you should do is that, okay, how to confirm diagnosis? Put like that, DKA. First is clinically, okay, abdomen pain, sweating, okay, comatose, okay, or he may be like in altered sensorium, okay. And what else will be there? He may have Kussmaul's breathing plus minus, right? So these are the things, and past history of diabetes will be there, family history of DKA, or young age. Usually DKA is present in type 1 diabetes. So probably early diagnosis of diabetes, which proves towards type 1 diabetes. So these are the points clinical. Then second, like laboratory. Okay, usually blood sugar more than 450, or in a digital meter high you will get. Okay, next is urine ketone positive. Okay, in ECG you may have some changes, like because when you start correcting, you may get hyperkalemia, all these things, parameters, hypokalemia, sorry, you may get these things. Okay, so these are the things we should write in clinically. So whatever is the positive points for diagnosis, both from history also you should come, investigation also you should come, then only go into the management. You're getting it? So how do you come at the diagnosis? How can you confirm the diagnosis? Also forms a part of your management. And similarly, based on that, when you are giving DDs also, say for example, abdominal pain, give 1 or 2 DDs there itself for the abdominal pain. Okay, Kussmaul's breathing, 1 or 2 DDs there itself. So that is what is DDs, right? If possible, how to differentiate from the DD also you can give it. Okay, one or just like as simple as well. It's all line diagrams. Don't worry, I will share an example for this also. Okay, from my notes. Okay, how to write this. 1 or 2 answer copy will be shared with you. Just have a look at it. So management always includes how do you diagnose as well as how do you treat. Both are management. That also you should remember. Okay. And say for example, psoriasis management alone is asked. Please do not write about the etiology of psoriasis. Not at all required. Just stick to investigation, diagnosis, and treatment. Bas. Okay. Never write anything extra because you don't have time in this paper. Okay. So next is someone, Vivek, you have any doubts?
Yes, sir. So for the attempt of next year, it's my first attempt only. So how should I proceed for the medical science? Because I don't have even grip on GS. Because it's my after internship this year, completing internship this year only in March. So I have only 1 year.
Yeah, Vivek, I'll just take your question a little later in 2 minutes, okay? Because it's like let other people, like I'll finish the exam related question, then I'll take your question, okay? Don't worry, Vivek. So first in the chat box, I have a few questions. Okay, do you use pen or pencil in the diagram? Okay, so always follow the same pattern. Say for example, if it is red, it's an artery. If it's brown, it's a muscle. Whenever HND is required, use only HND. Always try to pattern as you have done in your university exams only. But in case you are losing time and you need to just make one rough diagram, then you can use your pen. But try to use pencil only always wherever possible, because it's a technical subject. Technical details are very important. You're getting it. You cannot misuse, like you just put with a pencil, a muscle, and go off. No, not allowed. Whenever there is a muscle, use only brown color. It is the best thing to do. Okay. Introduction, conclusion. This is not GS. Don't worry about introduction, conclusion. Just write what is required. Okay. What is asked only you write. If you want to write more, you can elaborate on that only. Say for example, DDs. How to differentiate from like lupus. Say for example, when they asked about management of psoriasis is asked. So how to diagnose psoriasis, you will write. If you want to write extra, try to write how to differentiate from a lupus. That will at least carry more weightage rather than writing the introduction and conclusion for this. Because ultimately in management, diagnosis is the most important point. So clinical papers try to answer the answers also in a more clinical manner, in a practical way as you are going to treat a patient. What are the things you will violate? Like what are the things you will do? What you will do in a lab? What are the history you will ask? What are the family history you will ask? Everything has to be there. Even if it's management is asked, all the history positive points also has to be required, because that is how you come to the diagnosis. Okay, so no need for introduction conclusion. Okay. Should we draw diagram simultaneously with answers, or diagram first and write later? Okay. See, I personally feel like it all depends on the personal thing, whether you put diagram first or it doesn't matter. Okay, how you are comfortable with. What I do always is that whatever possible, I try to communicate with the diagram. Whatever I cannot communicate with the diagram only, I'll write in a paragraph manner. So I always try to put the diagrams first wherever possible, then I'll write, but it all depends from question to question. So you cannot just generalize. I feel whatever is comfortable for you, you can do it. Second thing is that, just 1 second, I'll take this page here. Sir, I left 50 marks twice in paper 1. Exactly. This is what I was telling you. A lot of people lose their marks because they don't manage the time. It's not just you. I've seen so many people missing a lot of time on paper 1, and they don't attempt even 25-30 marks. Just like that, they leave and come in the paper. So you should never leave even a single mark. At least try to attempt everything and come. That's extremely important, because being a doctor, you have some knowledge about every question. Even if you write something, you get at least 20-30% of the marks, which you should never miss. Okay. So please work on time management. You can work well. Okay. Just 1 minute. Difficulty in remembering content in medical science, how to tackle, about note making, books to preferred. Okay. Subject selection. Okay. Done. So exactly. So what book to read? Last 2 questions for those people who are attempting. Okay. What book to read? Do not try anything new now. Whatever you have read in UG, try to follow the same. In case possible, if you have your friends having marrow notes, DAMS notes, which is very short, you can even use that. Okay. Say for example, pharmacology, I've never read any textbooks literally during my UG days also. I read only that Sparsh Gupta review book, and I followed the same review book only till the end. So whatever subjects you are not able to complete, try to buy review books which has short notes for everything. Even that short notes will do. Don't worry, because the syllabus is very limited. We need to cover so much syllabus. So even with little bit of knowledge, you can try to attempt a lot of questions. Say for example, if you start reading KD3 Tripathi for pharmacology, what happens is that you'll unnecessarily end up reading T half. Okay, you'll be unnecessarily reading about adverse effects, side effects separately, so much in details. Then in the ultimate exam, you don't remember what you read also. Instead, what you do, say for example, there is a drug called albendazole. Yes, what are the things you need to read? Mechanism of action, 2 points about mechanism of action. Okay, where all its uses, 1, 2, 3, 4, 5. These are the uses. Side effects, what are the most common side effects? 1, 2, 3, 4. But that's all. That is your preparation. So whenever you are preparing for medical science, be smart. What will be asked only you prepare first. Extras you can see later. So that is why I told you from the beginning. Read question papers. How questions are asked. Based on that only your notes also should be prepared. No point in preparing the entire notes of albendazole, which is not reproducible in an exam. No point at all. Okay. So, and second thing is that, one more question I missed. So much content heavy. Yeah, medical science is extremely content heavy. How to remember it? There is only one mantra: revise, 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 revise. I know it sounds very silly, but ultimately that is the truth. If possible, you need to revise medical science at least 5 times before you go into the exam. So if you don't revise, especially subjects like anatomy, it just evaporates. Immediately it evaporates. And second thing is that having notes helps you here only. Because before the exam, we have 5 days of holidays usually, before the mains exam of optionals. So you need to have such small and short notes in such a way that in this 5 days, you can revise all the subjects possible. That's the best thing to do. Okay. Say for example, if I'll just give you one example in a common area. So let's take the simple example of joints only. Okay. So if it's a shoulder joint, you should have a simple 1-page notes of shoulder joint. You should not have more than that. Say for example, let's take embryology. Okay. Placenta is every time asked, functions of placenta. So you need to have like half a page or 4 or 5 line notes about this embryologica, this placenta part. So make your notes as small as possible. What you will remember, what you need to remember for the exam point of view only, you make notes. If you think that is too much beyond this, anyway, I will not write in the exam, please don't make notes also. You're getting it. Say for example, let's take the ulnar nerve example also. If you start making notes on the course of ulnar nerve, it starts from here, it enters through this fascia, it pierces this fascia at this level. Literally speaking, it's impossible to write in the exam also. You don't have that much time. And literally speaking, it will confuse you in the exam also. So don't try to remember all those things. Whatever you can remember, only have in your notes. Very simple. Line diagram about ulnar nerve. 3-4 points of remembering. Okay, which condyle it passes where? Okay, which canal it enters in the car, like Guyon's canal it enters. 3-4 points of importance only you note. Only that much only you can write in the exam ultimately. So all these things you will get how to read only based on your past questions only. see the past question papers, then you will understand how to prepare for it. Okay. So, and one more question regarding this means only, right? This is, okay, what is the likely diagnosis? What all is expected to be written? Also, differential diagnosis part, how much points to be written? Okay. See, what is the likely diagnosis? The best part about paper 2 in our exam is that usually the diagnosis is given in the question itself. When you read the fourth question, ultimately, what does it say? There will be a huge case given where a patient came with breathlessness, etc. You will be thinking whether it is MI or pulmonary embolism, etc. But in the question A, B, C, D will be done. In the fourth question, write about the principles of management of pulmonary embolism. Question will be directly given. So the likely diagnosis is also pulmonary embolism only. So that is a beauty which happens in our medical science exam. So it's good that you don't make mistakes in the exam. So likely diagnosis, usually they will definitely give one clinching point to make the diagnosis. Say for example, like even in dermatology where usually diagnosis is slightly difficult. So they will say that the rashes are not present behind the earlobes. That means it is not a photodermatism because behind the ear, the photo, like the sunlight cannot enter. So it's very specific. Say for example, if it is a vitamin D deficiency, like niacin deficiency, necklace appearance, 4Ds, dermatitis, death, all these things will be given. Some specific points about everything is definitely given. Diagnosis is always easy in our medical science, at least if you are thorough with the basic concept. Say for example, in pediatrics case, TOF usually is asked. So first thing is that it's a cyanotic disease, they'll give in the description. Second thing, the child is living beyond 5 years of age, they'll give. Obviously, the only cyanotic disease which child usually lives further is TOF only. Very easy. So if you read the concepts, definitely the likely diagnosis, you will never go wrong. It's very sure. Even if it is very confusing, when you read all the subparts of the question, you will have the answer in the subpart itself. Okay. So DDs, how to write DDs? Sometimes DD part is given only 2 marks. Sometimes DDs are given 4 marks for it. In case if DDs are given only 2 marks, just write name the DDs only 1, 2, 3, 4. For MI, DDs are 1, 2, 3, 4. Yes. If the same question, what are the differential diagnosis? They are given 4 marks weightage for it. Then you need to elaborate how to differentiate also. Say for example, it's a case of pulmonary embolism. Okay. So first DD you are writing MI. Okay. So how to exclude it? You will write that. Why not? Because STT changes are not there. Okay. Elevation depression is not there in the ECG. Second thing you will write, past history of immobilization points more towards pulmonary embolism. Just 1 or 2 points how to differentiate the DD from that main diagnosis. You're getting it. So this much is enough, but you need to slightly at least write 1 line elaboration why it is not MI, why it is PE only. You need to write for each and every differential diagnosis. You need to write because it's a 4 mark question now, not 2 marks anymore. So based on the marks, you write whether you elaborate DD or not. Okay. So I think this is it for 2022. I think I've covered most of the things. Is there anything people are going to write mains only? The last question you can take. After that, I'll go for the 2023-2024 batch. Is there anything for 2022 attempt? Okay, who are can you just raise your hands who are writing 2022 attempt? This means I would like to see 1, 2, 3, 4, 5. Ravi Mishra. Okay. Okay. Rahul, Vivek, Ankur, Rohit, Ajay Singh, Ravi Mishra. Okay. All the very best, guys. Do not worry. Medical science is a very easy option. When your strategy is easy, your exam also becomes very easy. Okay. Don't worry about it. Don't think that it's a huge subject. I have only 40 more days. Never worry. Only thing I will repeatedly tell you, go through the past 10 years question paper. If you can solve the past 10 years question paper, I'm telling you 275 is extremely guaranteed for you. And with 275, even you can go into rank 1 also. Don't worry about it. Okay. All the very best. If there's anything, you can always message me whenever I'm free. You can message me on Telegram. Guys, like in case you guys also want, you can message me. Just take my number. It is 999 99943 61689. I'll put it in the chat. But please excuse me, I can reply only on weekends. Okay, my training is also a little hectic. Whatever is it, just put it on a message on Telegram. I'll definitely reply you, get back to you on the weekends. Okay. All the very best, guys. You guys, if you want, you can leave. Go start preparing. Do not waste your time here. So now I'll take the other questions of 2023 and 2024. First thing is that note making. A lot of people have asked about. I'm weak at note making. I end up writing everything. Can we write answers directly from the book? See, note making is not. I would say that it is not mandatory because some people are very smart. They can directly read from the book and give also. I don't think so. That's up to your decision. But the problem arises when you have only 5 days to revise all the subjects. You have almost 14 subjects here. In just 5 days, if you have to revise all the subjects, it becomes extremely difficult. Especially you have books like OP Guide, PSM books you have. When you open itself, when you turn the pages only, you will feel, okay, this much is there, that much is there, etc., etc., etc. It comes. Okay. So that is where you get panicked, and that is where you don't complete also. What happens is that in the 5 days, first day you just spend only with anatomy entire day. Even then you won't complete anatomy also. You will just keep reading only one subject for entire day. That is the biggest mistake. That is why I say, even if you're not having the habit of making notes, make sure you make a short notes for everything. So at least 4 or 5 lines of shoulder joint, 4 or 5 lines of Allah now, 4 or 5 lines of tRNA structure. You're getting it. At least minimum notes should be there, so that 5 days you have to revise all the 14 subjects. Only then it is possible. Okay, minimum notes are definitely required, at least for your revision sake. Okay, that is the thing about note making. But otherwise, note making is your extremely simple strategy. Like according to your own strategy, you can follow. Some people will start making extremely detailed notes. Say, for example, just for the shoulder joint, they'll have 4 or 5 page notes, which is strictly, I feel it is waste of time. Okay, because ultimately we will not reproduce that much. Whatever you can reproduce, only you make notes. Maximum 2 pages or 3 pages notes. But whatever notes you make, definitely make sure you incorporate a lot of diagrams in the notes, because that is what will ultimately help you scoring marks. Okay, that is about note making. Second question, yeah, I am from a non-medical MBBS background as like BDS or physiotherapy. Then can you suggest books for clinical cases? Okay, Shilpi, I think I should take this question separately, because I personally feel this exam, I have seen people from nursing background who have taken this exam, but they couldn't score as much as possible, because especially when a paper two is completely clinical in nature. So first I would like to assess like what level of knowledge you have. And then I would suggest you whether you have to go for medical science. And in case how much ever is knowledge, I'll personally attend to this question, I feel. Okay. So you just leave me a message on Telegram. I'll reply to that. Okay. On this question. Okay.
Sir, I have a query, sir.
Yeah, Ashok.
Sir, what extent can we go for any case scenario regarding differential diagnosis, and regarding the cases? Can we stick to the syllabus as per the prospectus, or should we go a more extensive manner? Like we have in paper 2 anus rectum, like that anal canal in surgery. Should we cover all the cases related to that, or stick to the previous year? That's doubt, sir.
For example, anal canal rectum and all is fully there in the syllabus. If you just start reading, it becomes a huge subject. You're getting it. This is where your past question comes into play. So usually they have not asked questions beyond 3 or 4 areas. That is the only question which comes usually. You're getting it. So try to read that only. But only thing is that what my advice would be, first try to read what is asked only many times. Make sure proper notes are made. Other things, just for the sake of differential diagnosis, just for the sake of knowledge, probably just give a glance about it. Do not read or make notes too much about it. Just at least glance through it. That will be my advice. But only thing is that, say for example, let's take the example of dermatology. Okay. Because you have only 4 or 5 questions in dermatology. Psoriasis, lupus vulgaris, I think vitiligo is there. 4 or 5 topics only there. So what happens is that with this 4 or 5 topics alone, if you read and go, how will you write DDs? You cannot write it, right? So for example, tinea versicolor, tinea albicans. Okay, you are going to write so many DDs, like 4 or 5 DDs. That is when at least for a DD. So for example, a person comes with purplish patches. What are the DDs possible? You need to go beyond, little bit beyond the syllabus, because questions are usually asked on differential diagnosis. 4 marks on differential diagnosis. You cannot just give one differential diagnosis and say that I'll write for you get 4 marks for it. Not possible. You need to give at least 4 or 5 differential diagnoses. This is where I think your friends from dermatology can help, if you have anyone, or people who have the knowledge of dermatology, you can discuss with them for DDs. Or last part is that if not, you just go through the book. Okay, say for example, okay, plaques. What are the skin plaques possible? If you see that, what are DDs possible? What are the skin lesions with itching? What are the DDs possible? Skin lesions with, say for example, dermatitis, like lesion where you have secretions coming out. So what are the possible DDs? So that if you can correct as per the DDs, so you can match these DDs and write, because in the question will have purplish plaques will be there. So DDs for that. Purplish plaques, what are the thing? Other plaques, what are the DDs? Okay. Skin lesion with itching, what are the DDs? You can write separately subjects, topic wise also. Only then you will get 4 marks, or else you won't get that much marks. So what I'm trying to say is that ultimately in an entire area like anal canal or rectum, what you can do is that try to first read the questions which are asked only. Second thing, just for the DD sake, what are the DDs possible? You need to make a note of it. Third step only will be, like if you have completed all the subjects, other question papers, everything, then only the third step comes into picture. That is when you need to go and read about the other topics. Say for example, sigmoid volvulus. Important topic, but never asked till now. Okay. So these are the topics which obviously you will have an idea about it. So you go like after finishing this basics, then you go and read about sigmoid volvulus. At least you should have 3-4 points about sigmoid volvulus. So how do we diagnose sigmoid volvulus? Okay, it's a medical emergency. Obviously, you need to know clinical signs, extremely tender abdomen. Okay, patient will complain of constipation at least for 12 hours more than that. Okay, third thing, like if you take an X-ray, you will have a presence of air, or the sigmoid volvulus will be swollen. You can see that sigmoid colon can be represented. Even with E-fast, you can detect it, USG. So these are the diagnostic techniques you will do. And treatment, at least inserting the gas tube should be the first thing. You're getting it. So at least few points about every topic has to be read. There is no option for it, because if you are aiming for 300 plus, you need to write the compulsory also. So specialize on the questions which are asked, but at least generalize on the questions which are not asked, but a part of your syllabus. Just at least read, have 3-4 points about everything. Okay.
Okay, sir. Thank you, sir. Thank you, sir.
So anyone else has any other question?
So, my one question.
Yeah.
Sir, while we are comparing between two papers, paper 1 and paper 2, definitely, sir, what is the strategy for paper 1 and paper 2, scoring pattern in paper 1 and paper 2? And also, sir, definitely we have very exhaustive preparation for paper 1. And then very little time for paper 2. So how to manage that one, and what about the scoring patterns?
So even this is a very difficult question to answer actually, because I'll tell you, 2017 attempt, what happened was I got 167 in paper 1. That is like one of the highest in paper 1. I don't know how did I score also till now, because I read too much of my time was spent only on paper 1. Okay. So what happens is that the amount of time you spend on one paper, it directly translates into your marks also. Usually it happens like that. So that is the problem here. So you need to balance it. Say, for example, in some subjects you will be very good, but ultimately what we all end up doing is that paper 1 takes more time, because you have difficult subjects like anatomy. Okay, you have difficult subjects like physiology and all, which takes a lot of time to read actually, because we have a lot of topics in that. But when we come to paper 2, usually it's a clinical paper. So you will have some understanding about everything, because you have seen practically those cases. So according to the allocation of time, probably 60 to 65% of your time usually goes into paper 1 only, and rest 35 to 40% of your time goes into paper 2 preparation. But ultimately, it does not mean that this paper is higher importance than anything like that, because you have to score each and every mark possible. So I think based on your standard of preparation, say for example, I was little strong in medicine usually. So general medicine ka paper, I spend less time with it. So some people will be extremely strong in surgery. So those people will spend less time in surgery, like that. It's based on you. It's not that they are mandatory step that you should spend this much time on this, that much time on this. But only thing I would say is that clinical papers write as if you are seeing a person, because they are giving a case history. Okay. So what are the lines of management? Say for example, if a patient comes with a case is given about MI, okay, you will write about the history, all these things. How will you diagnose it? You will come about a little bit of history. You will write about investigations, what are things to do. When it comes to management, immediately what people will write is that they will start writing about, okay, they will give thrombolysis using altiplase or streptolizin. All these things they'll write. But that is not the first line of treatment, right? First, you give a stat dose of these three things. Okay. Okay. Then you make the person comfortably seated. Okay. Left lateral position if possible. These are the things they will be expecting. If you don't write left lateral position, I don't think that is an extremely important point. Okay. Oxygen, put an oxygen mask with at least 6 to 8 liters per minute speed. These are very small points, but this makes a difference. Even if you possible, try to connect continuous ECG monitoring needed. These are the points which will help you. Continuous SpO2 monitoring. Okay, if you want to put a central line and monitor the central venous pressure, possible. Very good point. Management may try to don't write like a theory. Try to like as a clinician. That will help you to score more marks. Okay, then you write about altiplase. Okay, first 160 minutes, I will give 1 mg per kg. Second 1 hour, I'll give this dose. Okay, fluids. Do not randomly give fluids. Always monitor central venous pressure and then give CVP and then give fluids. Do not overload the fluids, because it can cause pulmonary embolism, pulmonary edema. Write these specific points in your answer. It will be very beautiful. Only then you score marks. Okay, if it is a treatment of DKA, okay, always write about, like, don't write about insulin only directly. First, how do you write like normal saline, how much dose, how fast you give, how do you monitor hypokalemia, because you're going to give insulin, and how much dose of insulin you usually give. Okay, all these things. And when the blood sugar reaches around 250, how do you taper your dose of insulin? Okay, any emergency conditions, obviously you will use steroids, not in DKA, leave DKA, but most of the things you always give a dose of steroids initially. So all these things have to be like cleaning, like it's like treating a patient, what all you will do. If it's a trauma case, always write A, B, C, D, E, then only go to the proper management. You're getting it? So all these things have to be taken care of. Okay, write like a clinical answer. Okay. So then next question, sir, grossly saying in how much time we should complete our medical syllabus, because we have to complete GS syllabus also. Okay, this is one thing. And one more person asked about previously. Wait. Okay, fifth attempt. Okay, sir, how many months I should allocate for medical before prelims considering? Okay, I have to make some subjects, sir. This will be sufficient for medicine. Okay, so grossly everyone is asking about time. Okay, so I would suggest you how much time. Okay, this is a highly subjective question. Just I can give my experience only. So I think to make a very good notes about medical science, I think the minimum time needed for the entire medical science is at least 90 to 100 days. Like 3 months of medical science is needed definitely. Minimum before your prelims. But it does not mean that this much is needed. Suppose you have given prelims and you are going to start reading, you are going to read GS as well as medical science. Even in this 90 days after prelims also, it's doable. It's not that it is not doable because this is a subject which we have already read. Okay. So it all depends on how much depth you want to go. Okay. Say for example, if you have like till next prelims, you have time, make sure you finish your notes also right now itself. So it will take 100 days or 120 days. It's fine. But in case you're going to write this mains itself, there's no point in making so much notes right now. Make short notes only right now. So based on that only, I would say. But what I would suggest is that do not just focus only on medical science and for the next 100 days so that you miss out on the GS. So medical science you do every day 5-6 hours per day, half day you do medical science. And if you can do that, probably in 5 months time, I think entire medical science can be completed. Say for example, subjects like anatomy, surgery, I think these are the things which will take 10 days each. Otherwise, every subject max 5 days. It's possible. Okay. So, and it is very subjective. Yeah, I don't know how much you would take, but for me, I personally feel 3 months of complete preparation, definitely you can make complete notes and complete revision about medical science, I feel. Okay. So like if it's going to be your 5th attempt and you are going to give next year, when is the prelims next year? I'm sorry. What is the probable date for prelims next year? 28th May. Okay. So probably how many days you have approximately? 28th May means almost 250 days, right? 10 months you have. Yeah. So 10 months you have, I think you have enough time. No need to worry about medical science. You can definitely see, even if you have 3-4 months time, 4 months may definitely will complete medical science, and the remaining 6 months, it's more than enough for GS. Okay. So especially after mains, like say for example, you've completed your prelims right now. Okay. So you have 100 days for your mains. Let's say for the next year, I'm telling 23, 24 people are going to attend. So what you have to do is that you cannot just focus on like 40 days, 50 days only on medical science, because ultimately a GS has more marks than medical science, right? So that is when you need to be conscious about how do you allot time. So what I would suggest is that always divide your day into 2 parts. Half of your day should be on medical science, half of the day should be for your GS. But every day you read a little bit of GS and every day you read a little bit of medical science. And probably within 70-80 days, you need to try to complete both GS and medical science. So that last 20 to 30 days should be only allotted for revision, because mains may you have extremely limited time for both medical science as well as for GS. You need to have all the points in your fingertips, all the data. Say for example, corruption perception index. This year India's rank was 83. You should know that. There is no way escaping out of it. India's GDP is 2.7 trillion, 2.8 trillion, whatever be the numbers. You should know it extremely like in your fingertips. It's not like MCQs where you can, at least if you have a knowledge in prelims, you can just keep writing the correct answer. But it's not like that. Here too, all the points, all the data, extremely important data should be in your fingertips. You need to do multiple revisions as much as possible, so that try to complete your syllabus within 60-70 days. Last 30-40 days should be only for revision. That is a strategy for mains, I would say. Okay. So which mock test is better for medical science? It's a very difficult question to answer on this platform because it's from IIS Delhi. So I don't know. I really do not know about medical science test series, because there are, I think, 2-3 more institutes are also there. Kindly ask your friends and take opinion about it, because I have not written medical science test series apart from IIS Delhi. Even first attempt I wrote in IIS Delhi, so only I can give you a review about it. I do not know about other things. Okay. So here too, I think like last 3 years, I was only correcting the papers in medical science in my IIS Delhi. So I think they are doing a pretty decent job. So other institutes you can compare with your friends. Okay. For the next 5 months, 30% of attempt to medical science is sufficient, or more weightage. 30% for my 5 months, I think it should become sufficient, because 70-80% for 3 months you will complete, 30% for 5 months or 6 months probably. Definitely you will be able to complete your medical science syllabus. Okay. And
I have a query, sir.
Yeah.
Sir, I have started my preparation for next year, sir. Regarding GS, I have been pursuing coaching in an institute in Hyderabad, sir. And what I'm trying to do is, for the 5 days, I am reading GS continuously, sir. And for the last 6th day, I am reading GS for ethics, sir. And in the meantime, I'm getting only 2 to 3 days for my medical science, sir. Should I increase my time to medical science, or should I limit to 2 or 3 days, sir? What is your suggestion, sir?
Again, I think I will not suggest you in this because this is your personal thing. Only thing is that you have a timeline. Say, for example, if you think you should complete your medical science before December, make sure you are going the same pace. What you do is that take the syllabus. Okay, you first separate. Say, for example, if you are going in this pace, I think probably for anatomy only you will need 20 days. For physiology, you may need 10 days. To make a timetable like that based on the syllabus, because you.
No, sir. I'm actually, my approach is on one day I'm reading paper 1. On other day, I'm reading paper 2, sir, regarding section wise, sir, based on the prospectus. And I don't know when it will be completed, sir. But I'm trying to keeping it coping with that target, sir.
Yeah.
Is my approach or not?
Your approach is completely right only. Because what I would suggest you that first make a proper timeline. Whether you are sticking to the timeline or not, you first understand. Okay. Say, for example, anatomy, you will think that, okay, today I will do all the nerves in one day, but ultimately you will not end up doing all the nerves. So tomorrow you will be carried over. So while preparing for the arteries and venous system of upper and lower limbs, you make sure you allot similar amount of time. So based on 2-3 days or 1 month of preparation, you will come to know about approximate timings, how much time it is taking per subject and per topic. So based on that, you make a timetable. And if you can complete with the 2 or 3 days of weekly preparation, I think there is nothing wrong with it. So some people try to do both the subjects, GS and medical science, on the same day. Even if this is at the end also, it's fine. But all these things should be based on your plan up to when you have to do it. So it is completely personal. I think whatever you're doing is right only. Don't worry about it. Okay. So one more thing. Next question is George Matthew for medical science, medicine. So I read only George Matthews for medicine. So don't worry about it. I'm pretty sure that should be enough. And that's what. Do not try to change the books. I would say that. Do not try to read new books right now. Whatever you've done in UG, it's fine, because anyway, you will not have much time to read. So if you want to read something extra, try to read from entrance books like Marrow. Try to get your notes from your friends from Marrow or TAMS. That is the only extra reading I think you would suggest to do. Say, for example, if you had read Davidson's, try to follow Davidson's only. Do not come to Matthews right now. When you read Matthews, do not go to Davidson again. So I would not suggest you to change any books. In case you want to read anything new, go and try to value add from your friends' materials from PG preparation. Okay. So yeah, I'm at final year, going to appear in 2024. How to manage during it? Can we skip some days for preparation? Yeah. See, I don't know. See, I would suggest that. One thing I would tell you is that internship is also an extremely important part of our life. Okay. Because that is where you actually learn to be a doctor. Okay. I know your knowledge about medicine will not be useful in case you come into IAS. It may not be useful, but I would suggest you not to take internship also lightly. Okay. Because that is also an extremely important part of your career. And see, the problem is if you start being like mediocre in whatever you keep doing, I personally feel in the long run, what happens is that you just think about next, and keep going, and whatever you're doing, you will not do it as a perfectionist. So what I would say is that do not skip your postings on. Say, for example, there'll be some postings like gradient diagnosis, which you won't learn anything. Those postings can be skipped. But say, for example, postings like OG, surgery, these are like life skills for you. So try to be really sincere and then only manage your subject. Because what happens is, right, like I'll just tell you from my personal experience, life is something beyond all these services. I would say that. Don't think that I'm talking too much philosophical. Even after coming to service, what you will realize is that is just a starting of something else in future. Okay. Then you will think about something else, and that will be the beginning point of something else in future. It keeps going like that. So every point of time, you will be having different targets. So right now, all of you will be, see, I'm a person who is married right now. Right now, all of us will be focusing only on career. Once you get married, you realize that your personal life is much more bigger than a career sometimes. You will feel that. Okay. So every time your targets keep changing. Okay. So what I would say is that if you keep running behind the targets, whatever you're doing today, you will not enjoy. It becomes a hell for you. Second thing is that whatever you do, you will not be like, you should justify whatever you're doing. If you're a doctor, you should be a good doctor also. And I am pretty sure that if you are a good doctor, you'll be a good civil servant also. And that is how it gets translated. Every time, every stage of life, you need to try to be the best version of your possible. But it does not mean that you just skip okay, put the just escape from the postings, try to cheat and run away and do the postings. Please don't do those things. I would say that please try to balance both the things. Do not try to avoid good postings like OG, medicine, all these things, because anyway that will be useful. Anytime you are a doctor, okay, even if you're going in a flight, someone crashes, you are the one who are going to give CPR and revive them. So always you are a doctor. Please remember that. So that much if you can take care, that is the best thing possible. Okay. So balancing internship and your preparation, I think it is personally up to you only, but I would suggest do not skip your important postings. Okay. So if you want more details about how to manage internship and preparation, I think Akshita is a better person to ask, because she cleared during, like, immediately after internship, right? So I think better you can connect with her. She was the one who did both this thing and that thing. I think you can take suggestions from her. Okay. So if there is no more questions, I think I can call it a day. Is there anything else I should attend to? Any other questions? Most probable diagnosis question, or just one diagnosis? Most probable is like, if you most probable or most likely diagnosis means it's only one. Below that you can write DDs, but most probable diagnosis is only always one. Below that keep writing DDs. But if you think that there are two diagnoses which are extremely close, I don't know what to do. I think both are correct diagnosis. Even then you write only one in probable diagnosis. Other things should come under DDs only, because most probable is most probable, only one. You cannot have two working diagnoses when treating a person. Okay. Sir, can you repeat your telegram? Okay, just one second. Okay, so I should give my number again. Yeah, I'll put my number again for those people who have not noted it down. Just put it in chat. 9994361 Okay, so you can always DM me on the weekends. I'll be more than glad to answer your questions. Okay, anything else, or we can just sign it. Chakshu, you have any question? Okay, no problem. And yeah, regarding evaluation of paper, I'm really sorry. I'm really sorry to say that I personally feel I will not have that much time to go through papers or not. Maybe one answer probably you can send. I'll see and tell you what to improve. But an entire paper, literally speaking, it will be very difficult for me, because I really don't have time for those things. But I'll try my best. Try to send me, if possible, I'll do it. But if I don't review your paper, please don't mistake me from it, because hope you will also understand once you come into service, right? You don't have time for yourself. Okay, that is the only thing. Fine. So full length test should be given before prelims for medical science. Yeah, if you have time, try to give full length test before prelims itself. That is the best way possible. But in case if not, also it's fine. After your prelims also, you have 100 days. You have enough time to do that. Don't worry about it. Even like if you can give full and test series even 1 month before your mains exam, even then it's also good. But at least make sure each paper you give at least 2 full length tests. That is very important, I feel. Okay, then only you'll understand about time management. Okay. So anyway, thank you guys. Thank you so much for your patient listening. Hope I solved a lot of your queries and doubts. And whatever I've told you is based on my experience only. Okay. So you need to adapt these strategies based on your experience and based on your capacities, because everyone has a different approach. Whatever I have given is my personal approach. Hope that you don't make the mistakes whichever I have made, and hope that you all rock. And yes, 2 more questions I wanted to answer. Whether should I choose medical science or not? For those people who are going to start now, it's $1 million question. I'm telling you, it all depends on ourselves, because some people have scored really well with medical science. This time also, Anshu Priya, 16th rank, she scored very well with, like, even though she scored less with medical science, but she managed with interview, and she was my student of my interview program also. But she got 206 in interview. So she, like, sometimes things will happen even if you take medical science or not, doesn't matter. So what I would personally say is that it is always when you are fresh from medical science, first 1 and 2 years are the best time to have medical science as optional, because you are fresh from medical science, you are fresh from practice, you can give better answers and the best answers, because you will give practical answers also. But as the time goes beyond, if you're writing your 4th attempt, 5th attempt, 6th attempt, your medical science scores might seem to come down, because it's a very difficult subject and you get out of practice also, it becomes difficult. So in case if you think after 2-3 attempts you are not able to cope up with medical science, that is the time I personally feel a lot of my friends who have changed from medical science to anthropology or political science, they have scored very well there also. They got into service. So that is also a good option, but it is a personal choice whether to choose medical science or not. But I would say if you have been doing good in your UG with medicine and you are really scoring decently with all your university exams, go for medical science. But if you have even 2%, 3% doubt about whether I can do medical science or not, I think this is a huge service. Never choose medical science. Go to anthropology. Best option, one of the best options. or you can go to subjects like PSI, geography, so that your scores in your GS also increases. Okay, medical science, the biggest problem is not just about scoring in medical science. Essay, other things also becomes difficult when you choose medical science. But if you take subjects like PSIR, you can boost your scores in GS to essay also. So that part also has to be taken into consideration. But what I would suggest is that if you are taking medical science, be thorough with it. It is not a bad option at all, because every time you can do the basic minimum 10 years paper, you are 100% guarantee of a basic minimum mark. Okay, so it's a very good option. But for those people who are not scoring very well in medical science, attempt after attempt, and if you have crossed 3 attempts, I would tell you, as a word of caution, I'll tell you, try to consider other options as well. Okay, that is the best advice I can give you from me. Okay, about choosing this option. Otherwise, I think that is done for the day. Thank you so much, guys. Okay, all the very best. If there's anything, feel free to leave a personal message on Telegram. I'll take up your questions. Don't worry about it. And hopefully, I meet you in the interview program also. All the very best. Okay. Good luck, guys. Okay.
Thank you, sir.
Thank you so much.
Thank you, sir.
All the best. Do well. Good luck.
Thank you.
Thank you, sir.